Doxycycline is a commonly prescribed antibiotic, and if you're about to start taking it or are already on it, this video will give you the essential information you need. I'll explain how it works, what it does to your body, and the side effects you should be aware of. I'll also answer some of the most common questions I hear from patients in clinic, like can you drink alcohol while taking it? Might it cause thrush? What are the potential long-term effects, and how could it impact your mental health? It's important to be fully informed when taking any medication, so let's get started with what is doxycycline and how does it work? It's an antibiotic that's used to treat infections, including chest and dental infections, skin infections and conditions like rosacea, sexually transmitted infections, and other rare infections. It can also be used to prevent malaria if you're traveling abroad. So how does it work? Doxycycline is from a group of medicines called tetracycline antibiotics. They work by killing bacteria by stopping them from making the proteins that they need to survive. For skin conditions like rosacea, doxycycline is used to make the skin less inflamed. It's available on prescription. It comes as capsules, tablets, and tablets which dissolve in water. So who may not be able to take it? Doxycycline is not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to doxycycline or any other medicine. If you have kidney or liver problems, if you have an inflamed food pipe, if you have lupus and autoimmune disease, if you have myasthenia gravis, a condition that causes severe muscle weakness, or if you are pregnant or breastfeeding. So what's the dose? Your dose of doxycycline depends on why you are taking it. The usual dose is 100 mg to 200 mg taken once or twice a day for infections and skin conditions. You might take a lower dose, such as 40 mg once a day or 20 mg twice a day for rosacea or gum infections. The dose for malaria is usually 100 mg once a day in the morning. So how do you take it? Swallow doxycycline whole with plenty of water. Not swallowing them with enough water can cause swelling and irritation in your throat. It's important to take doxycycline while you're in an upright position. You can be sitting, standing, or walking. This will stop the medicine irritating your food pipe or stomach. Avoid lying down for at least 30 minutes after taking it. If you're taking a lower dose of 40 mg of doxycycline a day for rosacea or gum infections, take it at least 1 hour before food. If you're taking a higher dose of 100 mg or more for other types of infection, you can take it with or without food, but you're less likely to feel sick if you have it with food. If you take it twice a day, this could be first thing in the morning and in the evening, before you go to bed. So try to avoid lying down for at least 30 minutes after taking doxycycline. This helps to prevent any irritation. If you're taking doxycycline for malaria, start your treatment 1 or 2 days before going to an area with malaria. Stop taking it 4 weeks after leaving the area. Check with your doctor or pharmacist that doxycycline is the best medicine to prevent malaria in the country you are traveling to. So what are the common side effects? These include headaches, nausea, vomiting, and a photosensitivity reaction, which is when the skin is being sensitive to sunlight. I do talk about this in more detail at the end, especially for people going to hot countries who are taking doxycycline to prevent malaria. So what are the serious side effects? These are rare, and call a doctor now. If you have bruising or bleeding you cannot explain, including nosebleeds, a sore throat, high temperature, and feeling tired or generally unwell, these can be signs of blood problems. If you have diarrhea, possibly with stomach cramps that contain blood or mucus, and if you have severe diarrhea that lasts longer than 4 days, also speak to a doctor. Ringing or buzzing in your ears, pale poo and dark pee, and the whites of your eyes turn yellow or your skin turns yellow. These can be signs of liver problems. Or joint or muscle pain since starting doxycycline. Severe headaches, vomiting and problems with your vision. These could be signs of pressure around your brain. Or a fingernail that starts coming away from its base. This could be a reaction to sunlight called photooncolysis. A sore or swollen mouth, lips or tongue. Severe pain in your stomach with or without bloody diarrhea, nausea and vomiting. These can be signs of pancreatitis. Difficulty or pain when you swallow, a sore throat, acid reflux or a smaller appetite, or chest pain which gets worse when you eat. These could be signs of an inflamed food pipe or esophageal ulcer. Or if you have a serious allergic reaction characterized by facial swelling, breathing challenges and changes to the skin. Now, these are not all the side effects of doxycycline. For a full list, see the leaflet inside your medicines packet. Now, what are the cautions with other medicines? There are some medicines that don't mix well with doxycycline. Tell your doctor if you're already taking any of these medicines. Indigestion remedies, also called antacids. Stomach ulcer medicines that contain bismuth, such as Pepto-Bismol. Other antibiotics, such as Rifampicin. Acne medicines containing vitamin A, such as isotretinoin. Warfarin, a medicine to help prevent blood clots. Medicines for epilepsy, such as phenytoin or carbamazepine. Cyclosporin, a medicine that calms down your immune system. And if you have a typhoid vaccine given by mouth orally, this may not work properly if you're taking doxycycline. But it is okay to have the typhoid vaccine that comes in an injection when taking antibiotics, as it's not a live vaccine. And tell your doctor if you're taking any supplements, including anything which contains aluminium, bismuth, calcium, magnesium or zinc, or iron supplements. These elements can interfere with how well doxycycline works in your body. Similarly, it's important to avoid high calcium foods like milk, cheese and yogurt while taking the medication. Calcium can make it harder for your body to absorb doxycycline properly, which means it might not work as well. So now I'm going to answer some of the most commonly asked questions in my clinic. Can I drink alcohol while taking doxycycline? While doxycycline doesn't have a direct interaction with alcohol, it's still a good idea to limit how much you drink while taking it. Alcohol can make side effects more likely, which may reduce how well the antibiotic works, and can slow down your recovery by weakening your immune system. To help the medication work as well as possible, it's best to keep alcohol to a minimum during your treatment. Now, will it give me thrush? Some people do get a fungal infection called thrush after taking a course of antibiotics like doxycycline. This is because the antibiotics kill the normal harmless bacteria that help protect you against thrush. If this happens to you, ask your pharmacist or doctor for advice. And what are the long-term side effects? Taking doxycycline for a long time can sometimes lead to ongoing health problems, even after you stop the medication. Some people may experience lasting issues like kidney problems, ongoing joint or muscle pain, or permanent changes in tooth color. These side effects can affect your daily life and may need long-term medical care. And can it affect my mental health? The use of doxycycline may lead to mental health side effects, including mood changes, increased anxiety, and depression. These emotional effects can range from mild frustration to severe depression and are often worsened by chronic fatigue. Patients experiencing significant mood shifts or mental health concerns should seek medical attention promptly to prevent further deterioration. This comes after a senior coroner has demanded action from the MHRA, the UK's medicines watchdog, after a student who had taken an anti-malarial drug jumped from a plane to her death. I will leave the link to the journal article below. I'm also asked if taking doxycycline to prevent malaria while in a hot country, is it better to use another medicine so I don't react to the sunlight? Now, doxycycline has been used successfully in hot countries for many years. The best way to protect yourself against a reaction to sunlight is to be careful when out in the sun. Wear clothes that cover you up, a hat and sunglasses. Use a high factor, at least SPF 50 sunscreen or sunblock on your skin. So as we've discussed, doxycycline is a commonly prescribed antibiotic, but in rare cases it can have significant side effects that impact daily life, from headaches and vision issues to sensitivity to sunlight. For some, these effects can be severe enough to affect work, relationships, and overall well-being. If any of these raises concerns for you, it's important to speak with your healthcare provider for proper guidance. Now, if you found this video helpful, please give it a like and share it with anyone who might benefit. And don't forget to subscribe for new videos each week. And feel free to leave a comment below to let me know what you found useful or what you'd like to learn more about. You can also explore my other videos and playlists for more health topics. Thank you so much for watching.